So we've just been through some of the main components and the main criteria that we look at to diagnose PCOS. We will come back to the symptoms of PCOS because there are lots of them. But if you haven't yet, go ahead and download the PCOS deep dive workbook. It's found linked in my bio. But today we're going to actually go through the menstrual cycle. This is super important for you to understand and have like a base knowledge about, because understanding what's happening with PCOS, it's super important to have this as your foundation. So if you track your period and if you use one of the period tracking apps, you're probably used to entering the dates that you're bleeding on your app. Now, a lot of people focus on their period as the most important part of the menstrual cycle, but the menstrual cycle is so much more than just menstruation. Menstruation typically occurs between 2 and 7 days out of an entire menstrual cycle. And typically the general norm before a menstrual cycle is around 28 days. It's the generally accepted average. But in fact, the menstrual cycle is a range. It can vary between anywhere from 21 days on the lower end of the spectrum all the way up to 35 days on the upper end of the spectrum. And the reason why this is super important to know and understand is because there's different things happening at different points in your menstrual cycle. Your hormones are fluctuating throughout that cycle, and if you don't get pregnant during that menstrual cycle, then that results in the period. So the period is often considered the beginning of the menstrual cycle. Day 1 of your period is considered day 1 of the menstrual cycle. But really the period is what happens as a result of not getting pregnant or not getting a fertilized egg during that menstrual cycle. So I like to think of the phases of the menstrual cycle like the 4 seasons. It just helps to kind of define each phase of the menstrual cycle so that you can understand a little bit better. So starting with menstruation, this is kind of like the winter of the menstrual cycle. It's the time when you are bleeding, so the lining of your uterus is really shedding. And this is the time where you may notice your energy levels are really low. You're kind of turning inwards. You want to spend more time alone and introspect and just kind of take care of yourself almost during that time. And a lot of this is happening because at the point of your bleed, your hormones are at an all-time low. And that's actually what produces the period. When your hormone levels dip and eventually flatten out, there's nothing holding up the lining of the uterus anymore. And so that's why the lining begins to break up and fall away and shed. But just after your period, so as we said, typically you should be bleeding between 2 and 7 days. 8 days, I suppose, is the absolute maximum, but generally speaking, immediately after and actually during the menstruation itself, what's happening in your ovaries is that a new set of follicles is beginning to kind of start growing and maturing. And this is really known as the springtime. So after winter is spring. And if you think of spring, it's like the time where flowers are really starting to bud and bloom. And this is exactly what's happening inside your ovaries. So your ovaries house your eggs. And what happens during this phase of your cycle, also known as the follicular phase, a message from your brain is going to your pituitary gland, which is like the master gland of your endocrine system. And it's sending a message to your ovaries that, hey, some of those follicles need to start growing and maturing. The whole point of the menstrual cycle is so that you can get pregnant. And so your body is really trying to prepare itself for pregnancy. So what will happen inside your little ovaries is that a few of those eggs will begin to start growing and maturing. And in a normal menstrual cycle, what will happen is that at some point, one of those follicles will begin to mature a little bit more than the rest. And this is really super important because that dominant follicle is the one that's destined to leave the ovary, make its way through to the fallopian tube, and hopefully get fertilized so that you get pregnant. So it's during the follicular phase where those little eggs inside your ovaries are starting to grow and mature, where your estrogen level now starts to pick up. And estrogen is super important for not only growing those immature follicles, but estrogen is also a builder hormone. And it's really there to build up the lining of the uterus in preparation for the pregnancy. So that lining of the uterus is really like a cushion lining that's really rich in blood supply and nutrients. And the purpose of that is, at some point, if you were to get a fertilized egg that were to land inside the uterus, you need to be able to develop a blood supply that's going to be able to feed that embryo quite quickly. And so the whole lining of the uterus needs to be thickened and rich and ready for wherever that embryo may eventually attach. And so estrogen is working on growing one of those follicles, but it's also working on growing that lining of the uterus. And then ultimately, when the mature follicle is now ready to make its way out of the ovary, it eventually will burst out of the surface of the ovary, and it will leave like a crater behind it. If you kind of think of like a balloon that were to pop, right? Wherever the puncture were to be is where the little egg would have left the ovary, and everything left behind is kind of like a crater that's left behind on the surface of the ovary. And then what happens is that mature egg now will be kind of sucked up by the fimbria of the fallopian tube. It kind of makes like a wave-like motion to kind of suck that egg into the fallopian tube so that it can begin to make its way down to the uterus. And then hopefully somewhere between its transit from leaving the ovary to arriving in the uterus, it's hoping that it gets fertilized along the way. So fertilization actually takes place in the fallopian tube while the egg is actually making its way down to the uterus. But what's happening there when that mature egg leaves the ovary, that's known as ovulation. And this is really known as the summer of the menstrual cycle. It's the time where your hormones are super high. You'll be feeling the most energized, probably the most adventurous. You may even be feeling like you want to go out, you want to be really sociable. And this is the time where you probably are feeling your best in your entire menstrual cycle. Really, ovulation it's a moment in time, but it can happen around the midpoint of your menstrual cycle. And so ovulation is really the summertime of the menstrual cycle. It's actually the main event. It's the most important part of your menstrual cycle, because once you've ovulated, that crater that we mentioned that's left behind on the surface of the ovary will now begin to produce another hormone known as progesterone. Progesterone means progestation, and so it's really the pregnancy hormone. And progesterone's role is really to maintain the building that estrogen has done. So remember, estrogen was building up that lining of the uterus. Well, progesterone is really there to keep that lining in place, because hopefully that egg on its way from the ovary to the uterus is going to get fertilized. And so we need that lining still up there to make sure that that baby or that fertilized embryo has a place to implant into. And so this is the beginning of the luteal phase. And the luteal phase is also known as the autumn phase. And really it's because during this phase, if fertilization does not take place, then slowly but surely, eventually your hormone levels will now begin to dip. So progesterone from that crater that was left behind on the ovary will begin to get pumped out in high amounts and will eventually reach its peak. But if fertilization has not taken place, eventually progesterone also will begin to decline. And really it's this dip in the hormones that not only were building up the lining of the uterus, but also trying to maintain the lining of the uterus. When those hormones eventually start to decline, then there's nothing really keeping the lining of the uterus up anymore. And that's what happens when you have your period. Back to the winter phase. So just understanding what's happening in your body in the different phases of your menstrual cycle can give us clues as to what may be taking place in PCOS. So if you want to learn more about PCOS, we're doing a deep dive into PCOS in the series. So go ahead and follow along, and I'll see you in the next one.